Good evening, ladies and gentlemen. So, I am Dr. Bakshish Singh. I am Director in the Department of Nephrology at SPS Hospitals, Ludhiana. So, today we would be talking about understanding of CKD and its classic symptoms and what should patients should not ignore. So, welcome to today's session. We will discuss the understanding of chronic kidney disease and its classic symptoms. Let's start with what is chronic kidney disease. Now, chronic kidney disease is a disease which affects approximately 11% of the adults worldwide and 15.7% of the Indian population. It's a long-term condition where the kidneys gradually lose their ability to function effectively. According to KDIGO 2024, chronic kidney disease is defined as abnormality in the kidney structure or function with health implications present for at least 3 months. Chronic kidney disease is identified by markers of kidney damage such as albuminuria, which is protein in the urine which should be more than 30 milligrams per grams of creatinine, a urinary sediment abnormalities, any blood in urine, electrolyte imbalances, or histological or imaging abnormalities. Moreover, history of kidney transplantation or a decreased GFR, which is less than 60 ml per minute per 1.73 meter square of body surface area, can also suggest chronic kidney disease. This impaired kidney function significantly impacts overall health. To diagnose chronic kidney disease, healthcare providers use a blood test to check the glomerular filtration rate, a GFR, which is known as serum creatinine, and they also check a urine test to check for any protein leakage, which is known as albuminuria. Once the chronic kidney disease is diagnosed, the next step is to determine its stage. So there are 5 stages of chronic kidney disease. In CKD stage 1, usually the GFR is 90 or higher, which is said to be normal, but it has other abnormalities like it can have urinary sediment abnormalities, it can have electrolyte abnormalities, it can have histological or imaging abnormalities. In stage 2, the kidney function starts decreasing mildly. So the GFR is between 60 to 89. In chronic kidney disease stage 3, the kidney function decreases even further to a GFR of between 45 to 59. This is known as stage 3A. And in stage 3B, the kidney functions decreases further with a GFR of 30 to 44. In chronic kidney disease stage 4, the kidney function is now severely compromised and the GFR is only between 15 to 29 ml per minute. And in stage 5, the kidney function is just negligible with a GFR of less than 15, and shortly this patient is then going to require a kidney transplant or hemodialysis or peritoneal dialysis, which is also known as renal replacement therapy. Now, chronic kidney disease can manifest in various ways, and it is important to recognize the symptoms early. Here are the classical symptoms. So, early on, the patient may have just fatigue, swelling, especially noticeable in the ankles, feet, or hands. This is usually due to fluid retention. Then, change in the urination, which includes alteration in the frequency or volume, presence of blood in the urine, or foamy urine, which is very common, especially in diabetes. Then, shortness of breath, and in advanced stages, it can lead to nausea and vomiting, loss of appetite, retching, muscle cramps, and itchy skin. Now, several factors increase the chronic kidney disease risk. This includes the most common diabetes and high blood pressure. A family history of chronic kidney disease, aging, obesity also leads to diabetes and hypertension, and smoking also elevates the risk by damaging the blood vessels and kidney function. Now, early identification and management of these factors are crucial for preventing or slowing down the chronic kidney disease progression. Now, CKD often goes undetected in its early stages due to its asymptomatic nature and non-specific symptoms like fatigue or swelling or some amount of change in the urination, which can be attributed to other conditions or other lifestyle factors. The gradual onset of chronic kidney disease allows the patient to adapt to mild symptoms without recognizing their seriousness, and this contributes to delayed diagnosis. A lack of awareness about the chronic kidney disease symptoms further hinders early detection and timely intervention. And these symptoms can be masked by other chronic conditions as well, which are coexisting in this population, such as diabetes or hypertension, leading to underdiagnosis and disease progression. as we all know, chronic kidney disease can lead to serious complications. It can lead to cardiovascular disease, anemia, bone and mineral disorders, electrolyte imbalances, and fluid retention. And later on, when in the advanced chronic kidney disease, it can lead to uremic symptoms, increased infection risk, and sleep problems. To manage chronic kidney disease and reduce the risk of complications, there are certain essential steps which we can take. One is regularly monitoring the GFR and proteinuria annually for all patients, especially who are at higher risk, especially patients of diabetes or hypertension, and also patients who develop chronic kidney disease in the early stages. Then controlling the blood pressure and the blood glucose levels. This using appropriate medications and monitoring regularly. Once if you have your blood pressure and blood sugars under control, chances of developing chronic kidney disease decrease significantly. Managing anemia and electrolyte imbalances again important. Once the chronic kidney disease sets in, you have to treat with erythropoiesis stimulating agents. You have to give iron supplements and also modify the diet. To address the bone health, we have to use phosphate binders and vitamin D supplements to manage the minerals imbalances. And for lifestyle changes, you have to encourage regular exercise, smoking cessation, balanced diet, loss of weight in obese patients so that the chances of complications of chronic kidney disease are minimized. Patient education is a must by providing information about chronic kidney disease management and involving the patients in their care plan accordingly. And once the kidney disease is advanced, then you have to consider dialysis or kidney transplant to maintain the health and quality of life. According to the KDIGO, which is a Kidney Disease International Organization, the latest guidelines of 2024, the estimated GFR and albuminuria should be monitored at least annually once CKD is diagnosed. For high-risk patients, these parameters should be checked at least twice a year, and those at very high risk, that is stage 3 to 5, the monitoring sugar at least 3 times in a year. But why is this regular monitoring so essential? So let's find out. So see, regular symptoms checks play a crucial role in chronic kidney disease management. By early detection, we can delay the progression. So regular symptoms check and the regular blood test as well as the urine test enables early detection of disease, and chronic kidney disease often progresses silently, especially in the early stages when the symptoms may not be there. So by monitoring the blood tests or the urinary proteinuria regularly, changes in the kidney function can be detected early, and allows for timely intervention and timely management. Secondly, it also prevents complications. So monitoring symptoms such as fatigue, swelling, change in urination also help healthcare providers identify complications like fluid retention, electrolyte imbalances, and anemia. So early intervention of these can prevent the complications from worsening. That adjustment of treatment plans, like symptoms like headache can be due to high blood pressure, frothy urine can be because of protein in the urine. So declining kidney functions because of these may also require adjustment in other medications and lifestyle management. So regular checkups provide the information needed to tailor treatments plan effectively. Now, by these methods, we also improve the quality of life. By managing chronic kidney disease early and effectively, we can slow the progression of the disease, reduce its symptoms, improve the overall quality of life by decreasing the complication rates. It also helps us in maintaining optimum health and well-being of the patient. And lastly, in advanced kidney disease, it helps you to prepare for the advanced stages. So like for individuals who are risk of progressing to advanced chronic kidney disease or which was previously known as end-stage renal disease, these regular checkups can facilitate early preparation for other treatment options such as dialysis or kidney transplantation well before time, so that the transition from medical management to either dialysis or kidney transplantation is really smooth. So lastly, these regular checkups play a crucial role in chronic kidney disease management by enabling early detection, preventing complications, optimizing treatment plans, improving quality of life, empowering the patients, and then preparing for the future care teams. So make sure to stay proactive and work closely with your healthcare team to manage chronic kidney disease. Thank you so much.